what, when, where, and how. So specific one of the essential criteria for a well-written learning objective. M, every learning objective should be measurable and can be evaluated using clearly defined criteria. A, achievable or feasible, can be reasonably achieved within the resources available. And R, should be relevant, build on prior knowledge, and prepare students for their next task. And T, for time-bound, can be achieved within a specific time period. Okay? And here we can summarize the steps on how to write learning objectives. Step 1, start with the STEM sentence. After completing this module, after or by the end of this lecture or by the end of this session, you will be able to, and then we next determine the learning outcome in this step 2, and then consult the Bloom's wheel to select the appropriate level and verb, the action verb, and step 4, to write the verb and learning outcome into a statement that, when combined with the stem, forms a complete sentence. So all learning objectives do not qualify to be called good. The qualities of good objective can be enumerated as follows. It is relevant to the health needs of the society. For example, it prompts the student to learn more about tuberculosis than about degenerative disorders. So this is the R in SMART, relevant. The learning objective should be relevant to the health needs of the society. The second quality, it is not loaded with what is called window dressing. Rather, it is straightforward with no scope for ambiguity and subjective interpretation. Third quality, it is feasible within the given constraints and restraints of time, faculty, and university requirements. And fourth, it is observable. In fact, the whole emphasis in objective writing is on observability. And the final quality, it is measurable objectively, and this provides you and the student with a means on which to base feedback. So here we will run through examples of learning objectives. Some of them are good, some of them are bad. Examples of learning objectives in 2 of the well-known books used as references in the medical schools. Everyone knows the Snell's anatomy, and here we can see the chapter objectives. We don't have any action verbs. It is just the statements. You can see that contained within the protective, and the second objective, contained within the protective thoracic cage are the important life-sustaining organs, lungs, heart, and major blood vessels. In addition, the lower part. So it is just, there are no action verbs. It cannot be measured. It cannot be evaluated. Another example for poorly written learning objectives, this is chapter 2 in the short practice of surgery, in the chapter shock and blood transfusion. Learning objectives 2, understand. Understand one of the verbs that cannot be evaluated, that cannot be measured. So it is non-measurable verb. To understand, how can you assess understanding of the students about the pathophysiology of shock and ischemia perfusion injury? To understand the different patterns of shock and the principles and the priorities of resuscitation, and so and etc. So these examples about objectives in the chapters of our references in medical school. Time to vote now. You can answer in the chat box and give your opinion about this objective. At the end of the session, the students will be able to list the common presenting symptoms of colon cancer and discuss indications for diagnostic colonoscopy. Any comment about this objective?
دكتور وسيم لو توضح ايش تقصد بالكومنت يعني either they are good or bad or what you want. No.
Is there any error in the application of the steps of writing learning objectives, or it is a good example? You can comment about the use of verbs. I will give you a hint. Is there any problem with using these verbs? List is just memorizing. Discuss is not measurable, but it is mentioned, Dr. Hilal, in the list of verbs in the comprehension level. But I think
Yes.
it is hard to be measured.
Yeah, the magnitude of discussion probably is difficult to measure.
But there's one point I didn't mention about in the steps of writing learning objectives. Every learning objective should contain just one action verb.
True.
And in this statement, we have two verbs, able to list common presenting symptoms of colon cancer, and the second verb to discuss indications. So this objective should be written in 2 points, not 1 point. Okay. Second example, at the end of the session, the students will have changed their minds regarding the causes of homelessness. What is the false verb, Muhammad Nasir?
He mentioned the false verb.
Yeah. Change their minds, also not measurable, and even it is not precise. It is not a precise objective. It is vague. Third objective, we have just 5 examples, and then just summarize the false verbs. At the end of the session, students will be able to perform cannulation of a peripheral vein on a model. Any comment?
Okay, very good. It's a good or bad? Just that. Okay.
Yeah, it's really good, well-written learning objective. But if we look more specifically, it didn't the target audience just students. It should be, if we become more precise, it should ascertain at what level or what grade cannulation of peripheral vein on a model. Is it a first year medical student, second year, third year, final year? If we go further deep in the steps of writing learning objective.
And I think Wasim also the degree to the accuracy of performing the skills. Usually they put the degree of measuring the skills.
But this is a model, not a human being. I think
it's the same. I think whether he should be accurately, usually they put either accurately or in 95% they are able to insert a cannula inside the degree. You mentioned it, ABCD.
Yeah. Another point, it is not time bound. There is no time limitation. Whether 2 trials, 3 trials, how many trials is it open? Number of trials for the student to perform cannulation. I think these points, if we think about it. Objective number 4, at the end of the session, students will understand the etiology of breast cancer. This is an easy question. Unmeasurable, yes, because the verb understand is one of the verbs, poor verbs or bad verbs used in writing learning objectives. Number 5, last one, at the end of the session, students will be able to compare and contrast the pathological changes in Crohn's disease versus ulcerative colitis. Yeah, these are, of course, 2 verbs, but I think compare and contrast
Is giving the same
meaning. Just making the differences to recognize the differences between the 2 diseases, the pathological changes between Crohn's and ulcerative. Okay. A bad example also, learning objectives. To learn imaging anatomy of the anterior cruciate ligament, to know imaging appearances of anterior cruciate ligament, to become familiar with pathological conditions that might accompany anterior cruciate tears. If we change this example into a good example, it should be written in this way. A good example, learning objectives. Here we have in the bad example, we don't have the statement at the end of this presentation, participants will be able to. This statement is missing. And to learn, also a poor verb. To know, also unmeasurable. To become familiar, also not precise and not measurable verb. They should be changed in this form. Name and identify the two bundles of the anterior cruciate ligament. List 3 of the secondary soft tissue and bone findings of ACL tear, and to describe and reflect on how posteromedial and posterolateral corner injuries related to ACL tears. So these verbs should be avoided: understand, learn, appreciate, become familiar, and also we have all the following verbs should be avoided: become aware of, explore, familiarize, know or know how, improve, learn, and understand. And these two verbs, I've seen them several times in the lectures of in our college, learn and understand, and these should be
Frequently,
avoided.
no, Basim. Also, no.
No,
To
yeah,
know, to know, to know, to know.
even
Most of
to know.
the objective to know.
The favorite verbs in the knowledge verbs is define, describe, discuss, distinguish, indicate, recognize, select. In the competence verbs, analyze. This is the higher level. Analyze, apply, assess, create, evaluate, execute, implement, and etc. Okay, any questions? We can hear if there is any point not clear to you. You can ask in the chat box. What is the disadvantage of using bad words, Hamad Nasir? Because they are not measurable. Even they may be not achievable, and they will be vague for the student. The verb should be precise, achievable, measurable, and observable. The student should know. How can you measure the knowledge of the student? To know, just to know.
There is a question about the take-home message. They're asking about where does it fit into?
No, the learning objectives should fit just in the second slide after the main topic. It is at the very beginning of every presentation or every session, not at the end of the slides. Okay, Sima.
لا أعتقد سيما that يعني they are mixing between two things. The learning objective in any activity, learning activity, the first slide. Taking home message is a summary, and your main is a conclusion of your presentation. Take home message 1, 2, 3, 4. So there are two things different.
Can we use verbs not included in taxonomy, please? Not included? What examples do you have, Sana? I think we should follow the list. There are many verbs at every level, and we can choose between them.
Comment من محمد مهدي is very very important one. Degree, to which degree? نعم.
And even motivation, I think it is the most missed part from our experience as students.
True.
What's the meaning of the degree really help us in our orientation? You mean, Muhammad, if the learning objective is more clear and precise, it will give you more orientation, right? And it is missed almost on every lecture. Yeah. No, sure. You mean there should be a way to assess the verb? No, the verb should be measurable. I mean, we can assess the achievement of the verb, not assess the verb. The verb. Yani we can measure or we can observe the outcome in the student through this verb.
اكو سؤال من يقين همينه دكتور بسيم.
Yaqeen, should writing learning objectives always appeal to the Bloom's taxonomy? Almost all of learning objectives should follow the Bloom's taxonomy, but according to which domain? Cognitive, psychomotor, or affective domain? You can't use, for example, you can't use verbs from the cognitive domain for writing learning objectives for a communication skills session, because communication skill depends on mainly on affective domain, not on the cognitive. There is a cognitive part in it, but the demonstration of how to communicate or how to, for example, breaking bad news with a patient, it is a way of effective behavior, not just knowledge. It is not just knowledge part. We can assess it through written exam. It should be assessed through a simulator or patient communication with the student and see how the student communicate with the patient. Dr. Ja'far, there should be a question or number of questions in the end during the lecture regarding the topic to reflect the objectives. Yeah, you mean by this way you can, or the teacher can assess the students through their learning objectives, either in the formative assessment, and during the formative assessment, the students can be certain or can be sure that the learning objectives are followed in the exam, and they will not just read it and or skip it. If the learning objectives are followed in the exam and in the blueprint of the exam.
أنا عندي تعليق أخير هنا أنا قبل ما نروح لأن أعتقد التايم حتى لا يأخذنا دكتور بسيم. أولا دكتور ديار, the questions, it shouldn't be at the end of the presentation. It should be summary or taking home messages. Always we have to think not only on the domain of lecture. We have to say it learning activity, because the learning activity could be a large group, could be small group, could be practical, could be clinical. So now we are talking about a learning session, whatever the learning session. If we are talking on a lecture, every 10 minutes you have to do an activity, otherwise your audience will go down in their concentration on your presentation. Therefore it is better every 10 minutes either to ask questions or to have some sort of discussion or an activity, so that you can elevate again the attention of the audience. Therefore it should be at the end. أعتقد نروح للpresentation in order to save time, and we have final discussion after the end.
Inshallah.
Okay.
Okay, thank you.
Okay, Dr. Hilal, shall we present the second part?
Yes. Is it okay, obvious to you?
Yes,
Yeah,
it is.
yeah.
Okay. Now I am going to talk about what is the difference between designing a session for a large group teaching lecture. احنا دائما مشلبين بالlectures. ما أعرف ليش كأنما هي البروتوتايب for the learning activities, بينما بالحقيقة nowadays the recommendation large group presentation should be less than 10% of the total learning activities at any medical institution. Anyhow, what is the difference between designing an objectives for a learning session or for a clinical session from that of a large group teaching or a lecture session? Before that, I want you to answer this question. You can scan the barcode here or put that code hashtag 2215-293, and then you have to answer this question. If you have a phrase like to prepare students for lifelong learning in medical profession is goal, outcome, aim, learning objective, competency, we have to test your learning curve from the first presentation. Please vote. You can scan the barcode or you put the hashtag 2215293. Okay, only 3 out of our 40 attendee, 44 attendee, 10, okay? Okay, 19 till now. $21, 50% of the audience just vote till now. The other 50 are either not interested or what? Okay, 28, most of them, they are pointing to a goal. And 38% aim, 10% competency, 3% outcome, and 0 learning objective. Okay, I will not answer you. I will leave the discussion to the end about this question. Okay, now, are there any differences between writing objective to a clinical session from those of a larger group teaching? You can see this lovely elderly patient lying in his bed, and then you want to design a clinical session for a 5th or 6th year medical student and for a clinical session to examine this patient. For a clinical session, if we are designing a learning objective for a clinical session, definitely there is a practical application. So there must be an application because it is hands-on training. Therefore, it is hands-on. There must be interaction with the patient. Otherwise, you are asking the patient to take a breath or to turn one side, etc. There is some sort of interaction. And it is a real-world application of what knowledge you have learned during the theoretical or the preclinical phase. So this is one of the points that you put in mind on designing a learning objective to a clinical session. Example, by the end of this session, the student will be able to perform. هنا كان المفروض نزيد الليفل نقول the 5th or 6th year student will be able to perform physical examination of the cardiovascular system and accurately, the degree اللي قال عليه دكتور بسيم, accurately documents the finding. Not only able to exam, but to document these findings on a paper. This is one of the learning objective writing to a clinical session. The second, it is patient-centered. There is emphasis on patient care, safety, and outcome. And therefore, an example for that, student will demonstrate, this is the verb. Again, the medical student, we have to specify which level. Demonstrate effective, this is the degree. Here the degree is accurately, here the degree is effective. Communication with the patient, ensuring they understand the treatment plan. This is the second. So there is application, it is patient interaction and patient-centered. It is a skill, and therefore skill and procedures may be needed during this clinical session, and some competencies and procedures should be highlighted if it is needed, not necessarily in every session. An example, the medical student will complete competently. شوفوا هنا الdegree, you have to put the degree, competently insert an intravenous line. And the fourth is the assessment. We have to put in your mind how to assess this learning objective. Evaluation is often through either direct observation by the instructor or by a practical examination, a mastery examination for the practical skills at the skill lab, and using a checklist. Example for that, student will be assessed on their ability to perform CPR according to the established protocol. If we go to the lecture side, there is more focus on the knowledge acquisition, and therefore the objective typically focus on comprehension, understanding, and retention of theoretical knowledge. Example, by the end of this lecture, student will be able to describe the pathophysiology of diabetes mellitus, while there it was applied on the patient. Secondly, there is conceptual understanding, emphasis on understanding concept, theories, and principle. That was in the larger group teaching. And the example will be, student will be able to explain the mechanism of action of insulin, different from interaction with patient in the clinical session. Third thing, there is a critical thinking and analysis, and encourage analysis, synthesis, and evaluation. هاي الليفل اللي قال عليها دكتور باسيم بالبلومز، نصعد لفوق اللي احنا ما نشوفها حقيقة. We didn't see it in our practice in the medical school. Students will critique. Once they are able to critique, they have reached to a level of deep understanding of all whatever about the diabetes treatment strategies. They should know the diabetic treatment strategies, and then they will say the pros and cons of each one and compare between them and criticize them. So it's a higher level of knowledge acquisition. The assessment usually there, it should be by observation, by a practical skill examination, by a checklist, while here it is written examination, essay, and presentation as well. And the example for that will be student will be assessed on their ability to describe the stages of diabetic ketoacidosis, which could be on a written or by presentation. What is in common? These are the differences, but what is in common? اللي قالها أستاذ بسيم. They should be clear, they should be specific. Very important. Example, student will be able to list 5 complications of untreated hypertension. So they are clear, they are measurable, and they are specific. Both of them should have these SMART criteria. The second should be alignment with the outcome. Very important, Ikhwan. I repeat it. Everything should be linked with everything. Therefore, the alignment between the objectives with the outcome. And the example, this session objective supports the overarching goal of managing chronic disease in a primary care setting, because the objective should be finalized into an outcome. Now, we come to a practice step by step how to design an effective learning objective for a clinical session. The first and the most important, and please focus with me on this slide. First, identify the learning need. Assess the student current level of knowledge and skills, and then you have to build on them. One of the most important major problem we face, suppose I am a cardiologist, I am taking a fourth year medical student in a clinical session. I will start immediately a patient with VSD, ventricular septal defect, examination. I should know what the student reaching the stage before starting my session. Therefore, I should know what the medical student, their current level of knowledge and skill before starting my session. And this is very important. هذه ما نسويها احنا حقيقة. And frequently we are talking in one side and the medical student in other side, because we are not linking what we are talking of the session today, what he learned with that he learned yesterday. And this is very important. هي مثل البريد. هي بريد واحد يسلم لله. يعني student من يوصل لك إلى مرحلة رابعة, he should aware of the anatomy and physiology of the cardiovascular system in a good way, surface anatomy in a good way, before I start the session of examining patient with ventricular septal defect. So identify the learner needs. Very important. Just specify what stage they are and build on it. Second, define the desired outcome. أنت شو تريد at the end of this session, and clearly articulate with the student what they should able to do after the end of this session. This is very important. Clearly articulation with the medical student about what should they reach at the end of this session. And then we have to use the SMART criteria أستاذ بسيم اللي قالها: specific, measurable, achievable, relevant, time bound. يعني ما أخليها vague, not specific، غير قابلة للقياس. ما أخليها achievable and relevant، ما لها علاقة بالموضوع. أنا أريد أدرس الطالب examination of the cardiovascular system in order to pick up a VSD in a patient while I am teaching something else or I am saying something else. It must be relevant to the things I am using and time bound. أنا عندي ساعتين clinical session، ما يصير أخلي objective cannot be reached by these 2 hours. It should be limited to these 2 hours. Fourth, I have to incorporate Bloom taxonomy verb. واختار الverb according to the, I have to choose it according to the domain, whether knowledge or skill or attitude, and the level I want my student to act with. And then I should have an alignment with the goals, because at the end I want medical student, when completing 4th year, he is able to diagnose, treat, prevent cardiovascular diseases. An examination of the cardiovascular system is one of the outcomes that ended in these goals. Every time I should review and refine, continuously review and refine the learning objective based on what? أنا أسوي refinement based on what? On the feedback من the students ومن the colleagues, to ensure they remain relevant and effective. So these are the most important steps I have to pass in designing a learning objective. So in conclusion, إخوان, designing an effective learning objective for a clinical session is essential. Why? ليش هي مهمة؟ In order for creating structured, مرتب, goal-oriented, معتمد aligned with the goal, and practical educational experience. لاحظوا educational experience، ما قلت lecture. Educational experience could be small group, large group, practical, clinical, etc. ولا الآن بدي أتكلم عني على clinical. It should have a SMART: specific, measurable, achievable, relevant, and time bound, very important. And in the dynamic and in the demanding field of medical education. الفيلد مع medical education يتغير يوميا، طرائق التدريس بها هواية إضافات. And therefore, a well-crafted learning objectives are the cornerstone for a successful teaching and learning. From my experience, إخوان, in our current practice, there is no such a design of a learning objective to a clinical session, and we have to correct that. It is not a shame to say we are defective in 1, 2, 3, 4. It is shame to continue on it, but we have to say it what we are deficient in, and we have to learn it. Now راح أخذكم actual designing learning objective for a cardiovascular clinical examination session. Step 1, define the scope and purpose. What is the scope? Cardiovascular clinical examination. What is the purpose? Should put the purpose. Equip the student with the skill to perform a comprehensive cardiovascular examination, identify common cardiovascular conditions, and interpret the findings. So I put 3 purposes: examination, identify common cardiovascular problems, and interpret the finding. This is the first, scope and purpose. What is coming next? Identify the target audience. من هم target audience? Medical students. خلي أقول هنا as an example, a 3rd year medical student who are completed their basic cardiovascular physiology anatomy. This is the prerequisite. إذا أني طلابي ما متدربين على good cardiovascular anatomy and physiology ما أقدر أني أبدي clinical. هذا البريد، عصا البريد اللي يسلمها واحد للآخر. Very important إخوان. احنا لازم نربط preclinical ويا الكلينيكال in a very good way. Otherwise we cannot build one brick over the other. This is a very important message I want to deliver today. The third step, determine the key competencies. الآن أنت عليك إنه تحدد what are the most important competencies تريد الطالب after the end of this session have to acquire. إذن هذه الكومبتنسي بها skill وبها knowledge وبها attitude. أنا خليت هنا 4 competencies: performing cardiovascular examination, identifying normal and abnormal cardiovascular signs, interpreting the clinical findings, and communicating the findings effectively. شوفوا خليت 4 components of this step 3. Now, 4 الستيب الرابعة draft the learning objective using the SMART criteria. السمارت تعرفون بها من نعيد measurable, achievable, relevant, time bound. هذه لازم تكون موجودة بالobjective. الستيب الخامسة وهنا أنا مهم أشوف شو راح we are drafting the objective. الستيب الخامسة develop the learning objective. الobjective الأول اللي خليته بالبداية هو performing a cardiovascular examination. It should be specific. A student will perform a comprehensive cardiovascular examination. هذا specific للcardiovascular examination. Measurable منو راح يقيس؟ observed by a clinical instructor. الانستراكتور ده يراقب الطالب لطريقة إداءه للcardiovascular examination. So it's measurable. Achievable with guided practice and feedback. relevant لأنه هذا essential skills for diagnosing cardiovascular condition. لا يمكن أنه الطالب يكون competent in diagnosing cardiovascular condition without performing a cardiovascular examination. So it is relevant to the objective I put it. Time bound by the end of this 2-hour session اللي أنا خاله للإكزامينيشن. الآن الدرافت شو راح نسويها؟ الفاينل objective by the end of this session the student third year will be able to perform the verb comprehensive cardiovascular examination including inspection, palpation, percussion and auscultation with a 90% accuracy high degree as observed by a clinical instructor. لذلك شوفوا هنا أنا خليتها بطريقة واضحة ومطبق السمارت على الليرنينج اوبجكتيف بالبراكتيكال سيشن. من أجل الاوبجكتيف الثاني ايش قلت بيه؟ identifying normal and abnormal signs. Specific again because it will identify normal and abnormal. Measurable هنا شو راح اقيسها؟ راح اقيسها through a checklist and written exam للطالب. Achievable with practice and case studies and relevant for diagnosing cardiovascular disease. Time bound همنا at the end of the 2-hour session. شو راح يصير بيها؟ شلون اسوي draft للobjective؟ By the end of this 2-hour session, students will be able to identify هذا الverb normal and abnormal cardiovascular signs including heart sounds, murmur, JVP with 80% accuracy on a written exam and practical assessment. حددت الديجري من اسوي assessment عليها لازم at least he is attaching to 80% 85% accuracy. يعني probably he is very right in finding the mitral aortic tricuspid and pulmonary area, but probably he is not very good in localizing the apex beat. He is about 90% accuracy of the condition. ما أطول عليكم. Interpreting the clinical findings شو يكون الفاينل objective مالتها by the end of this session 2 hours third year the student will be able to interpret هذا الverb clinical finding and diagnose common cardiovascular condition such as. هنا أنا حطيت الconditions اللي لازم يشخصها hypertension, heart failure, myocardial infarction with 80% accuracy in a case study presentation. هذه طريقة الاسسمنت مال هذه الاوبجكتيف. وايضا الرابعة يعني قلنا communicating the finding effectively. فباي the end of this session the student will be able to communicate their cardiovascular examination. قابلية انه يتكلم عن ما لقاه. Communicate their finding effectively to peers للطلاب البقية and to the instructor, demonstrating clear and concise طبعا سيقولوا لي هاي two verb and concise reporting and appropriate use of medical terminology as assessed through a role play exercises. سادسا يجب أنه تكون هذه الobjective aligned learning activity. الobjective اللي أخليها لازم أسوي design للactivity تحقق هاي الobjective. For performing cardiovascular examination it should be hands on. لازم hands on practice. ولا كيف ممكن أحقق cardiovascular examination with a standardized patient أو real patient أو mannequin guided by the clinical instructor. زين identify normal and abnormal signs اللي قلناها شلون نقدر نحققها. ممكن interactive lecture نتكلم عليها في lecture. ممكن نراويهم فيديوز مالتي ميديا و practical session. Interpreting the clinical finding ممكن case study discussion, group work and problem based learning. Communicating finding effectively لازم تكون عن طريق role play أو peer feedback session and presentation. هذه 6. سابعا الاسسمنت. من اخلي الليرنينج اوبجكتيف لازم اخلي طريقه الاسسمنت. performing cardiovascular examination اما direct observation by the instructor with a checklist. identify normal abnormal sign written exam و practical assessment. interpreting clinical finding case study presentation evaluated by instructor. communicating the finding effectively by role play with peer and instructor feedback. يعطوا feedback للطالب. هاي طريقة الاسسمنت للobjective اللي أنا خليتها. أخيرا review and revise. always you have to review and revise. gather feedback. مين تاخذ الفيدباك؟ من الانستراكتور اللي وياك ومن الستودنت as well. review the effectiveness of learning activity and assessment. revise learning objective and activity based on feedbacks and outcome. اريد تسوون ريتنج الان للبرزنتيشن اللي شفتوه على نفس الكود اللي عندكم. من هذا البرزنتيشن تكلمنا هوايه يجوز اكثر من اللازم، لكن احنا ردنا نسوي highlight for the importance of learning objective. What do you expect this presentation will affect your future بالنسبه للطلاب اللي موجودين ويانا their future learning، وبالنسبة للأساتذة الموجودين ويانا for their future practice. How do this presentation or these modules we are doing will affect your performance in the future. ما راح أطلع من هالسلايد إلا أشوف فوق ال 30 واحد سوى voting حتى نعرف إحنا بيا اتجاه نفوت، وهذا جزء من الفيدباك which is very important for any activity in order for the planning for a better session for you for the future. So بعدنا ما وصلنا 30. لحد الآن. اوكي طبعا هذا الفوتنج هم يبين منو النايم منو القاعد منو اللي يعني دالغ بغير مكان. اوكي now we are 30. اوكي it's good. السكور من 7 إلى 10 تقريبا 40 60 80 83 which is very good. أنا أشكركم شكرا جزيلا، وأتمنى ما طولنا عليكم ولا كان بورينج هذا البرزنتيشن.